Hi, this is Eric Kim, and today I'd like to discuss our paper, Designing Chatbots with Black Americans with Chronic Conditions, Overcoming Challenges Against COVID-19. This paper was written by me, Jana, and my two advisors, Lionel Robert and Sanyong Park. Although chatbots are being actively deployed within the healthcare domain due to their advantages of being user-friendly and easy to use, they can become problematic when they do not consider the cultural context of a particular population, especially marginalized groups. Lack of incorporating the culture context can lead to reduced engagement due to lack of trust and rapport. So how can we design chatbots that addresses the cultural context of marginalized communities? We wanted to answer this question by specifically focusing on Black Americans with chronic conditions in the US. The reason for this is that this population has suffered from a disproportionate impact from COVID-19. Also, chatbots have the potential to meet the needs of this population through increasing healthcare accessibility, disseminating health information to those with low health literacy, and increasing trust toward health information. Based on this research question, we conducted a study to make the following contributions to the HCI community. We analyzed and defined the roles, features, and challenges of chatbots for the Black American community in the context of COVID-19, which had not yet been clearly addressed in the HCI literature. We suggested design guidelines for chatbots aiming to support the health of the population. And finally, we allowed participants to design their own chatbots remotely through Zoom for deeper engagement in the design process. We recruited 18 Black Americans with chronic conditions in the Midwest region and implemented our study through Zoom. Participants were ages 21 to 63, with the mean age 47. They consisted of 16 women and 2 men. Many of their chronic conditions were related to high blood pressure, although we did have some asthma patients. We went through 3 steps in our study. First, participants talked to a Facebook chatbot designed by the researchers. The purpose of this activity was to allow participants to get acquainted with chatbots and gather demographic information from the participants. Because many of our participants had no prior experience with chatbots, this process was necessary. Second, we had semi-structured interviews with our participants. We asked them about their challenges in maintaining their health during COVID-19 and how they obtained information about COVID-19. This helped us understand their health behaviors and barriers, which influenced how they designed their chatbots. The final step was to actually design their chatbots using a platform called botframe.com. We gave them 6 scenarios of possible challenges they faced during COVID-19 and had them choose one that they can best empathize with. Based on this scenario, they designed a chatbot that could help them go through the chosen challenge. After the design activity, we asked them to explain their expectations and reflect on their design decisions. We recorded and transcribed the whole process, which was about 27 hours of recording. Based on the data we collected, we went through thematic analysis and affinity diagrams to identify emergent themes. The 4 researchers gathered together in weekly meetings to review and discuss those themes and identified higher-level themes. Some examples of our resulting codes were chatbot as a communication channel, adapting to the user, or personal health impediments of users. From this analysis, we identified 3 main findings: roles of the chatbot, features of the chatbot, and challenges and barriers of using the chatbot. Due to time constraints, I will briefly introduce the first and the second one in this video. Please feel free to read our paper for more information. First, the role of the chatbot. We identified 4 roles the participants expected from the chatbot: mediator in accessing health services, personal assistant that provides personalized health recommendations, information hub for updates on COVID-19 and its vaccines, and trustworthy voice of the community. Regarding the mediator in accessing health services, participants expected the chatbot to act as a bridge between the user and the health experts. This reflected their own experience as a chronic patient who had to look out for themselves during the pandemic. For instance, Participant 1 designed a chatbot that served as a bridge where the questions user asked to the chatbot could be delivered to relevant health experts and receive credible responses. Moreover, participants wanted a support system for urgent needs without having to wait a long time to reach their clinicians. That's why participant number 8 wanted the chatbot to connect between individual clinicians and patients. She wanted the chatbot to be a temporary clinician that users can speak to because users should have access to healthcare at any time. Participants also wanted the chatbot to be a trustworthy voice of the community. During the pandemic, participants felt that their voices were not represented and have been deprioritized in favor of other needs, even when they were being disproportionately impacted by COVID-19. Therefore, participant 7 wanted the chatbot to be a channel that listens to the voice of the community and become a virtual representation of Black American leaders. Let me move on to features of the chatbot. By features, I mean characteristics or capabilities. Participants wanted from the chatbot a persona that engendered trust and comfort. While designing their chatbots, participants seemed to first draw a mental model of what the chatbot is, and then consider the conversation style and its capabilities. Participant 7, for example, said that people would be able to trust the chatbot more if it looked like a medical professional, and that would end up following its advice. It was also important for the chatbot to produce comfort and be relatable, as you can see from how participant 5 wanted to give the chatbot the persona of his mother. He projected his image of his mother onto the chatbot because he believed that the chatbot could also act like his mother in her stead when she was not there. So what do these findings tell us? One important takeaway is that our Black American participants wanted the information sources of the chatbot to be transparent. Because of the inherent distrust towards the medical system of the Black Americans in the US, they emphasized that it should pull its information from reliable and trustworthy sources, and those sources should be clearly stated from the chatbot. Another takeaway is that the chatbot design should incorporate the local community. Interestingly, when participants designed their chatbots, they immediately thought of the needs of others within the community, such as their family, friends, or neighbors. Because they share the same historical and cultural background, they wanted the chatbot to serve the group's needs and overcome the group's challenges, and thought of ways to help out the community. This tells us that when designing chatbots for our population, it is important to understand the needs of local communities, not only individuals. The last takeaway is to consider the socioeconomic factors of the population. Participants often designed a chatbot that can support the needs of lower-income households. Their designs work to fill their information gap or increase medical accessibility through the chatbot. We believe that it is important to design such chatbots so that the needs of the underserved population can be met. Thank you so much for listening, and let me know if you have any questions.